Hello, welcome, and thanks for joining us to help choose home when care is needed. A podcast all about the benefits, value, and safety of receiving care and services in the one place that feels most comfortable, wherever it is that the person needing care calls home. I'm your host, Marilee Orsini, and I've been involved in healthcare at home since 1981. Before we meet today's guest, a brief thank you to our sponsors and partners, the National Association for Home Care and Hospice, Access, and Core Cubed. Today's episode is number 18 of Season 3. Our guest today is Ken Albert, President and CEO of Androscoggin Home Health and Hospice, Maine's largest independent nonprofit home health care organization. Ken is a nurse and an attorney, and please help me, won't you, and welcome him to Help Choose Home. All righty. Well, let me say welcome to Help Choose Home. It's really a pleasure to speak with you today. Thank you for being our guest.
And thank you for having me.
Oh, good. Let's start with you talking a little bit about Androscoggin Home HealthCare and Hospice, and tell me what that does.
So Androscoggin is in central Maine, and it's a nonprofit home care and hospice organization that has been serving about 9 counties and about 185 communities for 55 years.
Goodness. And you joined Androscoggin, about 4 years ago now, has it been?
Exactly. Yes. And previous to that, in addition to being a nurse, I also practiced law, and they were a client of mine, and I had great admiration for them as an organization, and was pleased to be able to join them in this capacity.
Well, it seemed to me from knowing you and then refreshing myself with your bio that you bring an unusual combination of experiences to the home health and hospice field. Can you talk a little bit about how that has benefited your position there?
Sure. I think, I was a nurse. I've been a nurse for a lot of years, then went to law school, and I've had a couple different roles in my career, both working for the government in licensing and certification, and also as the director for Maine's Center for Disease Control and Prevention, really focusing on population health. So, I think my clinical experience, my legal experience, and then my experience in government, both federal government and state government, brought me to the place of leadership within the organization. And I think I'm where I'm supposed to be, quite frankly. I think my experiences have brought me to just the right position.
Well, it certainly looked like it. And what a time to be in home health care. So with your with your public health background and knowledge and experience, how is Androscoggin faring in this COVID environment?
I think as with everybody in home health, I think, I had an opportunity to go into acute care, hospitals, or I have a strong passion for home and community-based care. I think that people really want to be cared for in their home setting, if at all possible. And I think that's definitely a wave of the future. And one of my favorite things about home health is their ability to adapt. I think that, if you think about the home health clinician they're going into several different homes a day, and they're having to adapt to multiple different environments in multiple different clinical scenarios. I think that, we had to adapt very quickly to a COVID environment, and, understanding protocols and understanding, and the concerns from patients and their families about inviting people into their homes when we're all being told to stay, physically distant, yet these individuals need health care and can't leave their homes for it. And so it really, we had to grow in respect and appreciation for the concerns of patients as well.
And how did you do that, Ken? Was it an overall education program with everyone, or was it incremental, or how has that transpired to make your patients feel comfortable with having your nurses and clinicians go into the home?
Yeah, I think that, first off, we did a patient flyer that really just helped our clinicians have a conversation with patients and families about infection control standards and what we were doing to protect our staff and protect our patients. And we saw a small dip initially in patients refusing care in the home, but through good education, good conversation, and teaching patients what they could do to help protect themselves, as well as what we were doing to help protect them, I think really grew, a perspective of trust. We do not. We're exploring a what's called a Choose Home program, which is a skilled nursing facility in the home setting. But we have in our hospice side of the work that we do, we have a inpatient facility where we take care of hospice patients that cannot be managed, have their symptoms managed in their home.
Talk to me about that skilled nursing facility in the home program. That sounds interesting.
Yeah. So there's been a movement, over the past several years, and there's actually a bill in Congress right now with strong bipartisan support that would create an option for patients when they're being discharged from a hospital setting that they are able to choose either going into a skilled nursing facility for their rehab, which is generally a 21-day process, or they can select to go home and receive those same level of services in the home setting.
And the Medicare coverage goes to that home setting coverage the same as it would for a skilled nursing facility?
Correct. That's the idea, right?
That's interesting. You're also using telehealth, though. I'm pretty certain I read that.
Yes. Yeah. We actually started doing remote patient monitoring and telehealth about 22 years ago. And we've been expanding that service over the years and collaborating with hospitals and other primary care docs in monitoring patients remotely. And so this was the use of telehealth in a pandemic environment was no different to us than in any other environment, other than we've expanded significantly. I think we have slightly over 500 telehealth units that we have installed in people's homes.
Goodness, that's amazing. So do you get more information when you are using telehealth about what a patient's needs are and when there are changes of condition?
Yes. And so we're using them in a couple different ways. So the standard way is it's all Bluetooth technology. So we have scales, oxygen saturation, blood pressure, pulse ox, and we install them in the home and we teach the patients how to use them. They're left turned on, and our nurses who are remote receive data. So the patient knows every morning at 9 o'clock, I'm going to put my blood pressure cuff on, I'm going to put my saturation on, or I'm going to stand on the scale. And it sends that data through Bluetooth technology through to a central location where I have nurses who are looking at all this data coming in. And the software allows us to determine if there's a trend in the wrong direction, there's changes in historical patterns. And then we also use it to do patient education. So if there's a change in medication, we can specialize the training in short little modules so that patients and families can consume the information. And then we test their knowledge base with just a few questions to make sure that they understood what the education was. But we're also finding, I think, Marilee, that it's really helping with isolation as well. And it doesn't matter the age. So, my presumption initially was that, older folks would have a challenging time with this technology. That's not the case at all. We have several patients in their 90s, that are very agile with this technology. And they really appreciate the communication. Our patient satisfaction rate with remote patient monitoring is over 97%. And it really allows for folks who really don't have a whole lot of engagement with the outside world. It gives them somebody to talk to a couple times a day. It gives them an opportunity to be reassured that what they're doing for their own health is working or not sometimes. and we have to work with them. So it's really, it's a fascinating technology that I think all ages are enjoying. The other thing, if I may, Marilee, that we're doing is So for long-term care facilities and assisted living facilities that are experiencing COVID outbreaks, we have teams that are going in and installing remote patient monitoring devices. And then we have physicians and nurse practitioners who are helping these facilities to manage the patients to avoid transfer into the hospital setting. And that's been a fascinating use of this technology.
That does sound like a fascinating use of it. And has the fact that telehealth is now being reimbursed, correct, today? It seems like.
So there's a little bit of reimbursement for it. So it depends on how it's being used. But the reimbursement is certainly not sufficient at this point to cover the cost associated with it. But the trend is moving in the right direction on Congress recognizing the value of telehealth in the overall provision of care.
Mm-hmm. I'm getting the impression that because of all of our stay-at-home mandates over this last, almost a year now, coming up on a year, that the benefits and the safety and the value of care at home are certainly making themselves aware to Congress, because I'm feeling that there's more of a support and a push to refer to home care. Are you feeling that?
So we are definitely seeing that trend. I think what this has done is it's put a spotlight on, I'm going to use the word value of home care. Obviously, the cost of care at home is markedly lower than in a facility, whether it's a hospital or a long-term care facility. And so there really is a recognition of that value. And I also see the value extending to other healthcare providers, including primary care, who aren't able to necessarily see these patients in their offices for obvious reasons through the pandemic. And so where there's a lot more collaboration going on between primary care and home care to help manage these patients across the healthcare continuum in their homes.
And that sounds like a bit of a silver lining.
I think it is. That's a great word you use there, silver linings. I think we have to, when we're faced with adversity like this, we have to look for what we can learn, how we can grow, how we can improve care overall. And I think that coordination of care, the use of remote patient monitoring and telehealth is certainly part of that silver lining.
In this pandemic, have you all had an increase in COVID patients in your hospice program, or is that too short a time frame for them to enter into hospice?
No. So we have, I think the second surge, the first surge we did pretty well. I don't think we ever had, any more than, 10 or 15 patients at any given time who were COVID positive. Right now, we have well over 100 patients who are COVID positive in the home setting. When you consider COVID positive patients in assisted living, we're probably up around closer to 200 patients that we're helping to care for. And those are COVID positive patients or patients that are under investigation for COVID. And both those categories require the same level of personal protective equipment and infection control standards. So we've definitely seen a spike. And I'd say that it's split equally right now between our home healthcare population and our hospice population.
Project for me into the future, Ken. The vaccinations are underway, and it looks like there may be an end to the pandemic at some time within this calendar year. How do you see what we've been through as affecting or changing the industry?
So the Health and Human Services just came out with a letter to the governors, I believe it was yesterday or the day before, extending the public health emergency through the entire year of 2021. And I think the primary reason for that was to give states and the federal government an opportunity to collaborate and plan more effectively to navigate our way through to the end of the pandemic. I also see that what you'll see moving forward in the next many years will be a change in how we view and how we practice infection control, both in the hospital setting, long-term care, and in the home setting. I think this will forever impact our approach to mitigating the transmission of disease.
And can you be a little more specific about how you think what changes are going to happen?
So I think standards first and foremost. So whether it's government standards as they survey us to ensure that we're certified, that we're in compliance with Medicare conditions of participation, the standards are by which we'll be evaluated, whether it's by government entities or by accrediting bodies like the Joint Commission. Those standards have changed and they'll continue to be modified to ensure that we're being much more safe. How we screen people, we determine prior to embarking on care, on healthcare, whether it's in the hospital or in the home setting. I think we'll be much more cautious about screening people in advance of beginning that care for any infectious diseases.
So that sounds to me, I know that flu deaths are down this year, and no one predicted that. No surprise to me, really, because we're all at home and we're wearing masks. So,
Right.
Do you think something as simple as mask wearing? Because in other countries, I was in Japan in December of 2019, seems like, eons ago, but I would say 70 to 80% of the people in Japan were wearing masks at that time. And the standard was if you felt like you were getting a cold or had a cold or lived with someone with a cold, you masked up when you went out in public. Do you see that as something that people will finally be adhering to here in America?
Yeah, I think that we're talking about two very different cultures, aren't we?
Yes. Rule followers and rule breakers, I think.
Yeah, exactly. I think you will see a trend towards, being more cautious when you are out in public with masking. I think you'll see more hand sanitation stations moving forward, particularly in, high travel areas, trains, planes, high public areas. I think just culturally, we'll have a bit more appreciation for distancing ourselves from one another, as a means of preventing disease transmission, especially during high flu season or peak times of flu seasons.
Interesting. We're all looking forward, I think, to the time when we can look back on this time and say, well, these are the lessons that we learned. What are your goals? I know you just joined the National Association for Home Care and Hospice as a board member. Congratulations.
Thank you very much. Yeah, that's a really good organization. Strong advocacy for our industry. And, my goals is a couple things. One, we need to focus aggressively on our workforce. We have a tremendous shortage of healthcare workers, from physicians and certainly nurses and home health aides. I think, they are the unsung heroes. Oftentimes they provide the most intimate level of care in the home setting. And it's, I think their wages are a challenge. When you can, work at Burger King and make the same amount of money as you do as a home health aide, that's a challenge. And we need, our aging population needs this level of care. So ensuring that we have programs in place that foster professional development and foster more people into the health professions is going to be vitally important for us moving forward. I think that's probably the most important initiative that we need to focus on nationally is growing our healthcare workforce.
Interesting. How do you see your role as president and CEO of Androscoggin in a rural area? How do you see that role having the most effect to consumers or to people who would want to receive care at home?
So I think, communication, first and foremost. I do a lot, prior to the pandemic, I did a lot of public speaking out in the communities, advocating, whether it was through, business organizations or, there's a lot of area agencies on aging that have programs, really putting information out there about home care and the quality and the skill set of these licensed professionals who are providing care in the home. And also on the hospice arena as well. I think, we've gone from, the hospice benefit's only been around since the 1980s. So it's gone from this grassroots effort to a full-fledged Medicare benefit. And we, I think culturally we're growing an appreciation that hospice doesn't mean necessarily that these people are coming in to put you out of your misery. It means that hospice truly is about living until you can't anymore and maximizing that quality of life and allowing you to live your best life possible until your last day. And that's really through managing your symptoms, managing your medications, and identifying the patient and family specific goals so that we can achieve those goals in the remaining time we have left. Unfortunately, the length of stay in hospice, the mean length of stay in the United States is only roughly about, 17 to 18 days. And the hospice benefit is authorized for up to 6 months or more. And we need to drive palliative medicine and serious illness management further upstream and encourage more people to not be afraid of the word hospice and to appreciate more what it has to offer as a healthcare, as a true entity within healthcare to navigate serious illness.
And how do you think we can do that better?
We have to educate, primary care specialists like cardiologists, oncologists, who have a very curative mindset, right? Their approach is to make people better and to cure them. And not sometimes, but the majority of times as we approach the end of a terminal disease, we need to incorporate in our American culture more effectively the notion that appreciation that we are all going to die, and how we die and how we approach that chapter of our lives can be managed so much more effectively emotionally, physically, spiritually, reducing existential pain as well as physical pain. And so that concept needs to be integrated far more deeply into our education and training programs for our physicians and nurse practitioners and nurses. And then we have to educate the consumers and have public conversations about the benefits of serious illness management and being able to make decisions for ourselves in our own life's ending in a way that is, folks who navigate serious illness it's quite a medical experience. You're on a lot of medications usually, you're in and out of the hospital several times a year. You're beholden to a schedule and a regimen that might not necessarily align with what your personal goals are. And I think what really intensive palliative care does and hospice care, those are two different things. But I think what that does is it really creates a much more human experience. While involving good science and good medicine, it really focuses on the humanity of our livelihood.
Ken, you may have just stated that better than anyone I've ever heard state that. So I may transcribe what you just said and send it out to other people because that was very, very well said. Is there anything that I have not asked you today that you thought I was going to ask you that you would like to say?
I think, what I also really want the consumer of home care to understand, or if somebody's considering healthcare in the home, one of the things that I find all home care providers that I've had the pleasure of working with is there is an enormous respect for the invitation into people's homes. And that in addition to the professional skill set we bring into the home to provide healthcare, I want people to understand that there is a definite level of respect there, that we are entering somebody's home environment and that we're being invited in to provide that care. And I sometimes think that gets lost. And I think it's a really important and integral part of the service that we offer, a strong appreciation for that respectful relationship.
Wow, that's also very well said. Thank you. I really appreciate what you're doing. I congratulate you on your election to the NAC board. And also, I'm excited to see what happens at Androscoggin as you move forward in the coming years as president and CEO. So thank you for your time today. Very much. Very appreciated.
You're very kind. I appreciate those comments. And thank you very much for having me, Marilee.
You have a great day and stay safe out there.
Thank you. You as well.
All righty. Thank you so much for listening today, and a special thanks to our sponsors and partners, the National Association for Home Care and Hospice, Access, and CoreCubed. If you've not done so already, please subscribe to our podcast and take the time to leave a review on Apple Podcast. We are now also on Spotify and most other places where you find podcasts. Like and follow us on social media, and join us, won't you, to spread the word and help choose home when care is needed.